So I've actually snuck in a last minute title change to reflect the fact that I'm not only going to be talking conceptually today about the relationship between shared decision making and health literacy, but also some of our co-created local solutions that we've developed to support shared decision making in practice by taking a health literacy lens. So as everyone here knows, the Choosing Wisely campaign seeks to encourage clinicians and patients to talk about medical tests and procedures that may be unnecessary and in some instances can cause harm. And communication between clinicians and professionals, and patients, is considered a key mechanism for change, and this aligns with the concept of shared decision making. However, existing models of shared decision-making, such as the one on my screen, rarely account for health literacy, and they usually take quite a provider focus. So in 2019, we expanded this model to highlight the importance of thinking about health literacy in this context. This revised model embodies shared decision-making as a relational concept, as Alex was talking about, and necessarily involving both healthcare professionals and consumers. And this not only has implications for the way we think about shared decision-making, but also for the ways that we seek to support and promote shared decision-making in practice. At about the same time that we published that model, we also established the Health Literacy Hub in Western Sydney Local Health District. So this is a community of practice of over 1,000 healthcare professionals, consumers and researchers from our lab who come together to co-create and evaluate health literacy solutions, including interventions to support shared decision-making. In the hub, healthcare staff and researchers work together from the outset to frame locally relevant research questions, create research designs that reflect real-world environments, and commit to evaluating, implementing and using research findings in practice. And over time, as capability and understanding has evolved, there's been an increasing trust and partnership synergy between the local health district and our lab. We've actually been able to co-create a number of health literacy and shared decision-making interventions. And some of our co-created research to date has been about supporting changes to the way in which healthcare staff communicate with patients and consumers to ensure that health literacy is at the forefront of patient-centred communication. And there are a number of ways to do this, a few of which are shown on my screen. For example, much work is needed to decrease the grade reading level of decision aids and patient-written information. A recent systematic review of decision aids that we conducted found that only 12% of studies addressed the needs of low health literacy or other socially disadvantaged groups, and none were written at the 6th grade level or below. And so through our work with the Hub, we've developed what we call the Shell Health Literacy Editor. So it's an online editor which provides real-time feedback on how easy health information is to understand, such as patient decision aids, and provides suggestions on how to improve the information. And that's currently going through user testing and is officially being launched in June. We've also co-designed a number of health literacy training programs for staff in Western Sydney. And these include, for example, training in verbal communication techniques such as teachback, as one steps to supporting meaningful in-consultation dialogue. We've also progressed work with patients and consumers taking a health literacy lens. This approach recognises that making shared decisions, particularly about low-value care, requires a full spectrum of health literacy skills, from functional through to critical, communicative and critical skills. And though I think it's sometimes taken for granted, it's important to recognise that when we are asking patients to make shared decisions about low value or unnecessary care, it implies that they have basic reading and writing skills to obtain information and follow prescribed activities, that they have the skills to ask questions and articulate their values and preferences, and they've also got critical skills to weigh up benefits and harms and assess claims and to think critically. And that's quite a big assumption that we're making. And so to support our communities to do this in Western Sydney, one of the interventions that we've developed is Parenting Plus. So together with healthcare staff and new parents, we've co-designed this 4-week parenting program, which can be embedded within existing parenting groups. And it embeds health literacy skills into core topics of interest to parents, such as childhood development and first aid. And shared decision-making is included across all topics as a cross-cutting theme. And this includes through, for example, resources to facilitate discussions, group discussions about power dynamics that are real and exist within healthcare settings that Alex spoke about, but also real practical tools to help people engage in shared decisions and articulate their values and preferences. And piloting has suggested that the program is acceptable to a diverse group of parents. It's good retention, and we're moving on to an RCT of that this year, which is really exciting. Another example is the Success app, which is currently being evaluated in a randomised controlled trial across Sydney. And the aim of the app is to build health literacy capacity and enable shared decision-making for people living with chronic disease and requiring dialysis. And we do this by using a number of strategies to both reduce the complexity of information that's given to patients, but also features to help to enhance their health literacy skills. And so it's really taking a two-pronged approach, and it's designed to be complemented by strategically aligned interventions with healthcare professionals. And so to conclude, health literacy is core to shared decision-making, and this lens opens up new approaches to interventions, which both focus on systems and providers, as well as seeking to build health literacy capacity of patients and consumers. And we've been lucky enough to make this happen through the Health Literacy Hub in Western Sydney, through co-creative research and interactions. And in doing so, we hope to bring us a step closer in achieving the shared goal of enabling meaningful shared decision-making for all. Thank you.